we're Lexaria Bioscience. We are one of the largest holders of intellectual property in the cannabis space in the world. Certainly a top 5 or top 10 in the world, right up there with companies like GW Pharma or Canopy. We have 61 patents pending around the world and 16 patents already granted. That's us. I'm Chris. I'm the CEO and chairman of the board. But we're not a cannabis company, so that is something you should know. The cannabis company has adopted us as one of its own, God bless them, but that is not what we are. We are a biotech company. We currently operate in 3 different business verticals on the left-hand side of that screen. That is nicotine, CBD from hemp, and THC from cannabis. Very different markets, especially in the United States, where they are light years ahead of us in Canada on the CBD and hemp industry. And on the right-hand side of the page, the business vertical we expect to open in 2020 is our pharmaceutical division, and we'll get into the details of why that is. We have so much going on, it's hard to keep up. I've been on the road every week for the last 5 weeks. I've been home maybe a day a week. That's the way it is. On the left-hand side of the page there are some of the things that are going on right now in the cannabis sector. We recently announced our Dehydratech version 2.0. Dehydratech is the name of our patented technology, and we're working on the next generation of it. The industry is still trying to catch up to our first generation. We're very proud. But our second generation, we recently demonstrated some results where we are delivering cannabinoids into blood at over 800% higher effectiveness, as one example. We've signed 8 commercial licensing agreements this year, 4 in hemp, 4 in THC, and 1 in nicotine, including with one of the largest companies in the world. The person that you just listened to in front of me, Terry Donnelly from Hill Street Beverages, is one of our licensees. It is our technology that powers their products. We have so much going on. I could take an hour. On the nicotine side, we have partnered with Altria Corp, which is I think it's the 75th largest company in America. They did $27 or $28 billion last year. They are our licensee to use our technology for oral forms of nicotine delivery. You all know what's going on. You see the headlines about vaping and the illnesses that are being caused. It is tragic, but I have to say that it's such a partial story that you can't run with that without finishing the story, which is to say 54 Americans die every hour, round the clock. 1,315 people a day in America from smoking cigarettes. And there's 6 or 8 deaths from vaping. Our technology delivers nicotine in a way that will not cause cancer in oral forms, things like coffee, for example. Our technology gets rid of bitter tastes, gets drugs into your blood much more quickly. We have demonstrated in clinical tests that we can deliver drugs like ibuprofen, nicotine, or CBD into your blood in as little as 2 minutes. We work with the National Research Council of Canada as one of our trusted labs. We recently published the results of a human clinical study, one of the world's first, on absorption of CBD into blood as well as across the blood-brain barrier. That peer review article was just published in a respected medical journal in the United States last week. We have over 60 patent applications around the world, 16 patents already granted. We started filing patent applications in 2014 and had filed several dozen by 2015 and 16. So companies that talk to you nowadays in the cannabis space about filing patent applications today, as often as not, they're going to be out of luck because a lot of the IP space is gone. We happen to own quite a lot of it. Some of the things about our technology, there's a lot of companies out there that say, you know, we're just as good as Lexaria, or we have technology that does the same thing. We are very aware of who does what and who is not able to do what. And what I can say is that our technology is the only one we know of in the world, and we know of all of them, the nanotechs, the different absorption technologies, that does not require any artificial flavors, sugars, or sweeteners of any kind. We do not add any chemicals, and we do not need nanotech to make our technology work, although we have tested our technology to be inclusive of nanotechnology so that we can work with it to deliver even superior benefits. There's a lot of numbers there. Something you should know, every piece of data that you see on the screen that I deliver or speak to you of has been laboratory tested by a third party. In other words, we've done the work in our lab to see if it works, and then we contract a third-party lab, usually a lab like Absorption Systems in Philadelphia, Charles River, a very well-known lab in the US, or the National Research Council labs in Halifax and Montreal, and we verify all of our results. So a lot of companies talk about stuff, we actually do it. I don't have enough time to go through that. The curve is what matters. So that graph, we're the black line. And you can see time going across the x-axis on the bottom, and volume on the vertical axis. We get a lot of drug into your blood very quickly. This is taken from one of our human clinical studies, placebo-controlled, randomized, done at a medical university. One of our competitors, a Vancouver company that I'm not going to name, is the dashed bottom line that has a nanotechnology, and they say we're just the same as Lexaria. Well, does that look the same to you? With their technology, the maximum level of THC or drug doesn't get into your body for 4 hours. That's not good. With us, it's between 90 and 120 minutes. And we're actually dropping off, by the time that 4-hour mark comes, you're actually starting to feel non-intoxicated any longer with our technology. It's called fast on, fast off. We do it, other people talk about it, but they don't. Same graph with a positive control. And again, this was just published in Advances in Therapy, which is a peer-reviewed medical journal in the United States. I'd ask you to look at the two bottom bullets on the left-hand side, because this is quite unique. This study was co-headed by the head of the cardiovascular department at University of British Columbia, Okanagan, and as well as the PK data, the numeric data of how much drug we got into blood. We also investigated pharmacodynamic effects. Does it affect the human animal? And in fact, our technology has been proven to do that. We actually have proof that our technology in that bottle, Turbo CBD with CBD, lowers human blood pressure, whereas a positive control did not. The competitors did not, but we did. We also delivered more blood into the human brain, which is a very advanced technology that UBC has, so we can deliver more oxygen and more nutrients. The conversation goes all over the place. Our patents are pending, for example, for phosphodiesterase inhibitors, PDE5 inhibitors. Those are consumer products that are things like Viagra or Cialis, because they also rely on blood flow to have the effect that they are looking for. And we have already tested it that it works with us with CBD. Last month, we received our first 2 granted patents for we have 16 granted, but our first 2 granted patents for medical use. So for 3 years now, we've had patents granted for composition of matter and method of use, recipes and processes. We now have patents granted to use our technology to deliver CBD or nicotine to treat Alzheimer's, Parkinson's, and heart disease. So our company is advancing so much more. I know I have a couple of our shareholders here in the audience, and hi guys. And it's so different than it was 2 years ago that you'd hardly even resemble it today, or recognize it, excuse me. I just have to spend a minute on this. So I'm not a smoker. My dad died from lung cancer a couple of years ago. I'm not a fan. I'm not encouraging anybody to use nicotine. But there's 1.1 billion people who do. 35 million people who smoke in the U.S. every day. And 7 million of them are going to die this year. That's the numbers. This is a market. And we have partnered with the largest tobacco company in the Western world, Altria Corp. We are their technology provider for delivering oral nicotine without vape and without combustion. We can save hundreds of thousands of lives through that arrangement. And they have agreed to pay us a royalty. So we will receive, assuming they go forward, we will receive a cash fee for every dollar of revenue that they generate anywhere in the world utilizing our technology for oral nicotine delivery. I'm going to get yanked, so I have to go. Last numbers I'll show you on the right-hand side there. We deliver 300 to 500% more nicotine into the brain. We cross the blood-brain barrier. I have so much more to say. If anybody's interested, I have some USB drives with me, and I can give you our entire presentation. Thank you.